We were very concerned in Birmingham about a number of poor outcomes. Birmingham is quite a deprived community, so a lot of child poverty, and a number of children not achieving as well as they should.
At the moment in Germany we have the situation, depending on where you are living, where your family is living, whether you have more or less educational chances.
And we looked at evidence from around the world on what works to improve outcomes for children. We selected a number of evidence-based programs which we then piloted, and then following the piloting we evaluated using randomized control trials.
If we want to have really equal opportunities in Germany, we need first a transparent picture on how these chances differ in Germany, and then to have a debate about what can we do and how should we work to give an equal chance for every child.
We're not always going to succeed, and that's why it's really important to try out programs in the context that you're working. We know these programs work elsewhere, but are they going to work in the particular context with the particular children that you're working with?
Monitoring and assessment tools, if they are good, they answer some questions, but they raise more questions. And what we need of policymakers and all other stakeholders in the ECC system is that they listen to these facts and then they start a discourse on this.
Well, I think the bridge cannot be built entirely because there are different areas. The area of research is another area than the area of policy making. But it helps to understand each other better, and it lessens the frustration of researchers, and it helps a better understanding of research by policymakers.
I think it's much more useful to embed evaluation in the programs and policies and use it as a GPS. So an example of this, we created a new universal preschool program beginning at age 3 in New Jersey, and we did that by taking the low-quality childcare we had and transforming it into high-quality education. So we thought we know what we were doing, but there are lots of uncertainties. So we collect data on samples of kids, samples of programs. They're getting better, especially in language and literacy. But if we look at children's math scores, they're not improving. If we look at what teachers do in the classroom, they're not teaching math. So what do we need to do? Well, everyone needs professional development about math so that teachers will improve their practice.
Well, in Croatia we developed a self-evaluation model for self-evaluation for early childhood education and preschool education institutions. And it is very important to explore what is quality for key stakeholders. And that includes the policymakers, the decision makers, practitioners, teachers, and also parents, local community, and what is quality from child perspective. About improvement in this area, kindergartens are aiming to gain better collaboration and partnership with parents. And they are doing that through all different models. For example, they are trying to include parents in the process more.
Funding in the area of communications was absolutely critical in order to make the connection between evaluation research and policy and practice. So we funded journalists, we funded professional development for all journalists of various kinds of media. We funded researchers to become better communicators of their research. We funded writers and opinion makers to write about the issue, because we felt that being able to reach the general public was absolutely critical to make this connection.
One of the unique things about what the programme involved in Birmingham was cost effectiveness. And so on each of the programmes we looked at the cost benefit analysis. So the return over a number of years that you would get if you implemented some of the programmes.
Policymakers have a number of problems when trying to use evaluation to guide policy. The Dutch government changes every 1.5 years, so it doesn't seem like you could actually guide government much with a 15-year study. The other problem is that if your evaluation is about whether a program or policy works, then there are going to be resistance. People who do it believe it works, so that's why they do it. So you're asking them a question they think they already know the answer to. And if your answer is that it doesn't work, they're going to be very resistant to changing.